braces on, we need to do what we call records, and we use some of the information gained from the initial visit where we do the photographs on the panoramic x-ray, but then we also need to take, as a standard procedure, as part of going into orthodontic treatment, you take a lateral head film and models, little moles of your teeth. Some people call them statues of their teeth. And we construct those, and from that I can take measurements. I can study the patient when they're not here, what their dentition is like. I can look from behind as though I was sitting in their throat and look, anteriorly, which of course I can't do that, with the patient. So it really helps a lot. And from the models, I'll pick out the brackets, and I do try to customize the bracket setup for each individual. I don't just say, okay, here's a set of brackets, we put those on everybody. I don't do that at all. It's all customized depending on the size of your teeth, shape of your teeth, and what I feel will work best for you in that particular situation. And we use a lot of self-ligating brackets for full braces, for some of the beginning, just minor stuff that we need to do for kids in the mixed dentition where they have some baby teeth and some permanent teeth. In that instance, we just use a non-self-ligating bracket, but I use self-ligating bracket, and what a self-ligating bracket is, it has a door on it, and there's all kinds of different designs of doors. There's probably, I would guess, 7 to 8 different makers of self-ligating brackets, and I try to choose the one that seems to work best for me. The main advantage of self-ligating brackets is the fact that you can take the wires in and out quickly. And there is some mechanical advantage insofar as there is lower friction typically in tooth movement, but I think the bigger factor really is ease of treatment of that patient. So they come in and they have a limited amount of time they can be here, and you can take the wire out, you can adjust it, you can put on a new wire very quickly. And so you can make more progress more quickly. Also, we have some real high-tech arch wires. They're made of specific alloys of metal, and they will last for many, many, many weeks, many times. And we're able to do it for that long a time period. So a lot of times your treatment intervals are, you only come in every 6 to 8 weeks, unless it's some special circumstances. So then you get your braces on. Usually it takes about an hour to bond all the brackets, and I do it myself directly in the patient's mouth, and then I fit the bands if they need bands, metal bands that go around the teeth. We only use just a very few of those. It's mostly brackets, and then we put the arch wires in, and the whole process will take, maybe an hour and a half, 2 hours. Just depends on the complexity of their situation, how many teeth they need to have brackets on, and we just try to set it up where they can come in, get their appliances on, they have a certain adjustment time period, and then they're off and running, and they come in, like I say, about every 6 to 8 weeks. It's pretty typical for us. And then, you go through the process of having the alignment done, wearing elastics many times, sometimes not, but most of the time you need some sort of elastics. And we rarely use a headgear anymore. It's been quite a while since I've used a headgear appliance. And it's mostly rubber bands, and then once you get to the end of the process, and for some people it's as little as 12, 13 months, and for some people it might be 20 months or 22 months or 24 months. But a lot of people are finishing at about a year and a half, 14, 15, 16, 17, 18 months is a pretty typical time period for them to be in treatment. And then they go into retainers, and we use one of 2 different types, or actually 3 different types of retainers. We typically use a fixed retainer on the lower arch to make it a little easier for the patient, if we're able to do that for them. And then in the upper, they either get a retainer that has a wire in the front or a clear retainer. And so we kind of give them a choice. If there is a choice they can make. Now sometimes we have to go one way or the other, very definitely, but 90% of the time we can give people a choice there, and they seem to like that, they get to have a say in things. So that always helps.